Hi, good morning, everybody. Thank you for joining CareOptimize's Insights 2020 webinar series. Today we will be discussing COVID-19 and its impact. This is a part 2, a follow-up to what we discussed last week. The first topic that we're going to be discussing today are industry updates. So the first update that we have is in regards to CMS waiver updates. The biggest impact that we have here is on the amount of states that have been approved for the CMS waivers. So last week we were at 13 states. This week we're currently up to 38 states. So 38 states have been approved for the following waivers: to temporarily suspend prior authorization requirements, extend existing authorizations for services through the end of the public health emergency, modifying certain timeline requirements for state fair hearings and appeals, relax provider enrollment requirements to allow the states more quickly to enroll out-of-state and other new providers to expand access and care, and also relaxing public notice and submission deadlines for certain COVID-19-focused Medicaid state plan amendments, which will enable the states to make changes faster and ensure that they can be retroactive to the beginning of the emergency. The following states are enrolled or have been approved for these waivers: Alabama, Arizona, California, Colorado, Connecticut, Delaware, Florida, Hawaii, Idaho, Illinois, Indiana, Iowa, Kansas, Kentucky, Louisiana, Maryland, Massachusetts, Minnesota, Mississippi, Missouri, New Hampshire, New Jersey, New Mexico, New York, North Carolina, North Dakota, Oklahoma, Oregon, Pennsylvania, Rhode Island, South Dakota, Virginia, Washington, and Wyoming. These are changing as we speak, so there could possibly be more at this time, but that was the latest update that we have. More information can be found at the website listed on the screen. Okay, the next big update that we have for the industry is in regards to Medicare advance payments. So under the new stimulus package that was just approved, providers can receive accelerated or advanced payments for Medicare. This applies to all hospitals, physicians, DME suppliers, and other Medicare Parts A and B providers and suppliers. This is under the CARES Act, which stands for Coronavirus Aid Relief Economic Security Act. President Donald Trump signed this into law last Friday, and it enables all Medicare providers to tap into an emergency fund in order to help with their cash flows. According to CMS, the provider must have billed Medicare claims within 180 days immediately prior to the date of the signature on the provider's or supplier's request form. They must not be in bankruptcy. They must not be under active medical review, and they must not have any outstanding delinquent Medicare overpayments. So to apply for this, you must complete and submit a form. You can do that on their website. It's the MAC website, Medicare Administration Contractors. After you submit the form, the provider's identification must be documented, or the supplier, including their legal business name, correspondence address, the NPI, and then any other information that may be listed on the website. You must also address how much money you are requesting. So the amount requested based on your need, and also your reason for request. The request can be submitted multiple ways, but electronic on their website is the best. So CMS is actually currently accepting these requests now, and payments are going out in as little as 7 days. Okay, also small business loans are available. These can you can apply for these now, starting April 3rd. Anyone with revenues less than $12 million qualify. They will be retroactively paid from February 15th and currently it will run through June 30th. That could change. It will cover 2.5 times the average monthly payment up to $10 million, and loans will be forgivable if you do not have any layoffs. Something that I want to mention in regards to the Medicare advance payment, these may need to be paid back. CMS has extended the repayment of these accelerated payments to begin 120 days after the date of issuance of payment. And that is broken out by provider type. So people that qualify for 120 days of repayment are children's hospitals, certain cancer centers, critical access hospitals. They actually have 1 year to pay back, and the payments begin 120 days after the issuance of the payment. All other Part A and Part B providers or suppliers will have 210 days from the date of the accelerated or advanced payment to repay the balance. Okay, now we're going to talk a little bit more about telehealth and telemedicine and the difference between the two. So for telehealth, those visits are for patients that have been seen in the office within the last 7 days for a follow-up visit of the same problem. For example, medication refills, lab results. You must also be qualified for telehealth, like FQHCs, RHCs, IHS, and CHCs. But the new legislation expands where the originating site was, and it can be waived if you are providing services as to what is referred to as a hotspot. For telemedicine, those visits are for any new patient only during a public health emergency, which we are in, or established, and a video conference must take place for this and documented in the EHR as a regular office visit. So some key points here. CMS waived the qualifying rural area facility requirements during this public health crisis. HHS and the OIG gave providers flexibility in either reducing or waiving patient costs or copays. And these services are not just restricted to COVID-19 visits. If you have a rash, cold, any other problems, maybe you're experiencing anxiety and need to talk to your provider, those can be seen through telemedicine. And state, Medicaid, and commercial payers also have announced that they will have the flexibility around telehealth and telemedicine, but those details are not currently available. Okay, so the next item that we will discuss today is some CareOptimize offerings that we have and related to this COVID-19 coronavirus. So we are offering two complementary tools. We have a crystal report, and our crystal report will generate a list of your most at-risk patients for the coronavirus based on the patient's chronic conditions. It can be used for patient outreach to ensure that your most at-risk patients are receiving appropriate care. We are currently working with a few practices on this. We actually will be getting into this a little bit later, because this is really working well for a few groups that we have implemented this in so far. We're also offering a coronavirus template and document. This template and corresponding document will walk your providers through the process of handling a potential coronavirus case. It screens for other potential causes of the patient's symptoms, for example, pneumonia screening, influenza if they've had their vaccines. It also allows the users to notify different users of the case and provides the ability to document specific actions concerning the case. So on that template, you will see places to document who in the office was in contact with the patient, was the patient wearing a mask the whole time, has the room been disinfected, things like that. Okay, now we're on to our clinical case studies. So there are a few practices that we have implemented some of these tools at that we are assisting with their new way of practicing medicine with what is going on currently. So we pulled together a few key points from what we've learned from working with them. So the groups that we're working with are Premier South Medical Group, CareMax Medical Centers, and Sunrise Cardiology. The first one that we're going to review today is Premier South. So Premier South is a 3-location fee-for-service primary care provider in the Atlanta metro area who has switched to telemedicine and chronic care management to keep up with revenue when patient visits have dropped. They're also offering wellness classes. So a few key things here. They're offering the wellness classes such as Zumba and Facebook on their Facebook page via live feed. They are outside triaging at the clinic. So you'll find that all of our clinics are conducting this practice, that nobody is allowed in the clinic without first having their temperature taken outside to determine if it's safe to let them in. Every person coming into the visit or coming into the office must wear a face mask. So staff and patients are all wearing at least face masks. Staff is wearing face masks and gloves. They are trying their best to not cancel any appointments. So they are a fee for service, so their appointments are directly tied to income, so they're trying to convert all of their appointments to telemedicine. Currently, they have managed to hold on to at least 70% of their revenue by using telemedicine visits. They are also primarily doing these over video. If the patient doesn't have a video, they are still talking to their patients on the phone. In case of emergencies, they are not sending their patients to the hospital unless it's deemed necessary by a provider, and they have a media campaign going on and being contacted via email and text to ensure that everybody is doing well. Okay, our next group that we are working with is Sunrise Cardiology. They are a 2-provider fee-for-service cardiology group who has switched to telemedicine, remote patient monitoring, and home visits to keep up with revenue when their patient visits have dropped. So one of the unique things that this group is doing is they are no longer just specializing in cardiology. They have converted into a more of an internal medicine group. So this is the group that is using our report. So they're running a report to find patients with highly chronic conditions, and they're being called and texted to make sure that they're doing well. So in the phone calls, the patients are being triaged if they seem to have any COVID-19 symptoms according to CDC guidelines. They're instructed to go to their nearest community testing site. And Sunrise is keeping an updated list of available sites. So that might be something that you would like to consider doing, and if you suspect your patient has something and need to refer them to get tested. Also, being a cardiology group, there are a lot of diagnostic studies that need to be done to care for their patient, but unless it is critical, they are rescheduling all of their diagnostic tests, elective diagnostic tests, to be completed 2 months out. So only patients with severe cardiac symptoms are being brought into the practice. And of course, they will be wearing face masks, and the staff will be wearing face masks and gloves. And if they have a temperature, they would have to be very, very careful. I'm not sure what's happening if the patient does come in with a temperature. Depending on the severity of the case, so if the patient does need to have surgery, CABG procedure due to a blockage, they, of course, will still be doing surgeries on the patients that are critical. The last group that we have a case study on that we are working very closely with is CareMax Medical Center. CareMax Medical Center has 8 centers in Miami serving high-risk, low-income patients in a global capitation model. Their focus is heavy on moving into the community to keep their needy patients at home and help prevent this spread. So these are some offerings that CareMax helps assist with their patients. They have transportation, primary care, many specialties, labs, pain management, psychiatry, at-home visits, pharmacies. So they're an all-inclusive medical center group for the elderly and lower-income patients. So they have a high vulnerable population. They're seniors, low income, multiple chronic conditions. So these patients need to stay home, especially during the time that we're currently in. So early on, they closed their CareMax closed all their wellness clinics, but the medical centers still remain open. They are also doing, taking their temperatures outside before anybody comes in. Everybody in the staff is wearing face masks and gloves. They are doing wellness checks. So every CareMax member is being called every week for a wellness check. These are primarily to answer any questions that the members might have and make sure they have enough food, and to reiterate the importance of healthy habits like hand washing and social distancing. The primary message is CareMax is here to help. If an inbound call happens, the staff is informed to do a scripted screening question with the patient. So, are you having any symptoms? Have you traveled outside the U.S.? Has anyone you've been in contact with traveled outside the U.S.? Do you have a cough, fever, or shortness of breath? And if they have answered yes, then they are scheduled for a virtual visit. If they answered no, they are always welcome to have a virtual appointment, but they're not immediately scheduled unless they would like one. Transportation. So if the patient needs to be transported to the clinic, they must first have their temperature taken and answer the screening questions. If they have a fever or exhibit any other symptoms, or they answered yes to any of the screening questions, they're not allowed to get in the van. But they can still have a virtual visit. And I find this next item really, really helpful to the patient. Because we got to keep them home. And a lot of the patients don't know how to use technology, but we still need to treat them via telemedicine. So what CareMax is doing is they purchased 20 tablets to be able to conduct virtual visits with the patients who don't have the technology or the knowledge to do it themselves. So the drivers will go to the member's home and turn on the tablet and queue up the virtual visit for the patient. They'll give them the tablet and the virtual visit will take place. And then after the visit, the driver of the van takes the tablet and disinfects it and then drives to the next appointment and gives the user a tablet to use for their visit. They're also delivering food to ensure that their patients don't go outside to the grocery store. So food deliveries now top at over 500. We need to keep our patients happy and home and make sure that they're eating. So another way that we keep them happy, or CareMax is keeping them happy, is by providing silver sneaker classes. So Zumba, chair yoga, things like that. They're doing virtual bingo. So it's keeping them engaged so they maybe don't feel as isolated in their home. There is also media campaigns that are in English and Spanish and Creole with safety protocols and ways members can contact CareMax for questions. These were sent to all members. They're planning on sending out flyers every 2 weeks. And another way that they're working on keeping their patients safe is they're being encouraged to call CareMax first before going to the hospital. So this is going to hopefully reduce any unnecessary visits to the ER. CareMax always has somebody available 24/7, even if it's just to talk and ask questions. And that is the end of our presentation today. So if you want to find more information, please feel free to go to our website or any of the following websites on the screen. And you can always contact me, Lauren.Pacone@CareOptimize.com or info@CareOptimize.com. Thank you, and hope you all have a great day.